Welcome to Chamber Chat. I'm Stephanie Ford. This week, we are chatting with Dr. Clark from AdventHealth. Welcome.
Thank you.
Tell us a little bit about yourself and your specialty.
Okay. To begin with, I am an orthopedic surgeon. I specialize in hand and upper extremity. I got interested in orthopedics when I was actually in high school. My dad was a professional soccer player in Brazil, and so I was always involved in sports. And I thought initially I liked the rehab portion of it, but then once I was exposed to surgery, I just knew that was for me.
Very cool. I love that. Tell us a little bit more about orthopedic hand and upper extremities. What are some of the kind of things that you're seeing or symptoms that people are having?
Okay. So I feel like it's the best subspecialty, but that's just me. But we see a lot of unique stuff with hand and upper extremity. We do take care of all the fractures from the shoulder all the way down to your fingertips.
Okay.
But a lot of what we see is also overuse injuries. So we see a lot of nerve compression. So carpal tunnel syndrome is probably one of the most common things we see, which is just compression of the nerve at your wrist. We see a lot of overuse tendonitis, like the quer veins, tennis elbow, trigger fingers. But unique to orthopedics and hand, we have a lot of tendon injuries and nerve injuries. So, you can cut the tendons in your hand, we repair those.
Wow.
If you have really bad nerve compression, we can do tendon transfers to compensate for that. So, in addition to the total joints that you see in the lower extremity, we do total joint replacements in shoulder, elbow, wrist, and I do all the finger joint replacements too. So the small joints.
Oh my goodness, there's a lot going on.
It is very unique. A lot of it is smaller, but it plays into affecting everybody's everyday life. And so
absolutely.
We get to see a lot of unique things.
And what do you think are some of the causes? You mentioned, your dad was a soccer player and sports, but what are some of these injuries coming from?
So it's kind of a combination of everything. Like trigger finger per se. It's a very common diagnosis that we also see. The most common reason for that is just idiopathic, meaning that it happens, but you do see it also after trauma. The repetitive overuse, we see people typing constantly, being on a computer. Some of that is related to just doing too much. Right. But a lot of times it can be related to working in a poor position. So, if you're typing in this position or in this position, that's not good for your body. So it's kind of a combination of doing too much sometimes. It can be related to trauma, but it can also just be related to positioning in everyday life.
Just wear and tear over time.
Right.
What's the point where somebody should maybe stop ignoring the signs and symptoms and come see somebody like you?
So normally what I tell people is if you feel like you have a problem every day and it's happening for a week or two, you probably need to start doing something about it. Nobody wants to go see the doctor, but if it bothers you every single day, then you need to do something.
Yeah.
And so I kind of use that as a general rule.
That's good. I like that. So it's something different every single day, so that's kind of tough for me to tell what to address. And then what about preventative? Is there anything we can be doing at home or doing on our own to help with some of these symptoms?
I think a lot of that is just being aware of what you're doing. I think that's how a lot of people get themselves into trouble, is they're going to paint that wall for the next 2 hours, and they're determined to get it done. So I think listening to your body, being aware, realizing that you may not be able to accomplish everything on your time frame. Yep. Again, a lot of it is just too much activity at one time.
Right.
The
just
trauma,
kind of slowing down.
Right.
Yeah.
Accidents happen. That I don't know that you can necessarily prevent. The overuse, yes, and I think a big thing that we see is also just ergonomics. I think we spend so much time on computers and tablets nowadays, and you may be sitting in this bad position, holding and typing for hours. And if you think about it, you're like, well, that wasn't very smart to do that. Right. But when you're when you're engaged with something, people will do that for hours. So that definitely contributes to a lot of what we see.
Yeah, so just some awareness and kind of, it's all about, especially like when you're working out, it's technique, right?
Right.
So just being mindful of those kinds of things.
100%.
Talk to us a little bit about technology. I know AdventHealth is leading the way in all kinds of great new technologies and robots, and we're always learning about new innovative things. Anything in your field?
I mean, probably the most common minimally invasive surgery that I do is endoscopic carpal tunnel releases. So, it's about a centimeter incision at your wrist. We use a special camera to cut the ligament. The nice part about that is we don't have to cut all the muscles in the hand, which makes the recovery so much easier. It's about a 10-minute procedure. It's outpatient. People come and go the same day. They have some instant relief once the pressure is off the nerve. I also do shoulder arthroscopy, elbow arthroscopy, and wrist arthroscopy. So same thing, a procedure where we used to have to make a big incision, now we just make a couple small poke holes and we're able to take care of everything that direction. So that definitely makes a big difference.
Oh, absolutely. And you're talking about extremities that you use every day, all the time, so that recovery time is really important.
Right.
So that's great. Well, this is a lot of great information. And if you are looking for more info, want to schedule an appointment, we have that on the screen. Thank you, Dr. Clark, for joining me. So great to meet you. And thank you to Shark City Media for producing this content.